This recording is the second part of recording that was covering blood vessels. So the previous recording I had stopped pretty much at the capillaries and was discussing the capillary beds. And now I want to kind of talk about that blood going back to the heart from those capillaries. So let's look at the venules. Venules are kind of like tiny veins. They extend from the capillaries and then merge together to form the veins. The veins are thin-walled vessels. They have variable number of tunics. So, for example, a venule does not have a tunica media. Your medium-sized veins here, those have a thin tunica media, very little smooth muscle. Their tunica externa is actually their thickest layer. Your large veins have have all the tunics, and actually they have a relatively thick tunica externa. All the veins carry blood under low pressure, so they're thinner walled than you look at with the arteries. Now, one of the things that we're going to look at very shortly is that some of our veins have valves. So those are folds of that tunica intima, that endothelium, that helps to provide one-way direction of blood flow, prevents backflow of blood going back to the capillaries. Now, so I want to look at that venous blood flow. So we're going to be looking at blood going from the venules to the veins back to the heart. And I had mentioned that the pressure is very low, and it has to get that blood back to the heart, and often it has to flow against gravity. So as you're standing up, you've got, because the effects of gravity, blood wants to pull to your feet. So what are means do we have to ensure blood is going to go back to the heart? Okay, so let's look at first thing. So we want to make sure the amount of blood returning to the heart from the venous system, that's your venous return, is equal to the amount leaving your heart, that's your cardiac output. We want them to be equal, otherwise blood's going to be backing up somewhere. So one of the things that we have is the veins, they have larger lumens. So you can write larger here. Now if you look at the microscope slide where you have an artery and a vein, you notice the vein's not maintaining its shape. This is something you'll see with the microscope slides. The reason why they're not maintaining their shape is without that blood in there holding it open and that pressure pushing up against the wall, is they'll collapse because they don't have all that elastic, those internal and external elastic membranes that arteries have. And you can actually here, you see this kind of like this. That's actually the internal elastic membrane that you're seeing. The external elastic membrane's out here. Well, the veins don't have that, so they're not going to hold their shape. But if you look carefully, if I open this up, and if I had blood in there, that lumen is much bigger. Veins hold more blood than arteries. The veins are capacitance vessels. Just remember that. Okay, so this is going to become important. So they're all about blood storage. So they have these larger lumens. Okay, so that's really not going to explain why we get more blood back to the heart, but I just want to mention that. Well, larger veins have valves to prevent backflow of blood. So you can actually see the valve right here. So just think about it. You're standing up, you want blood to come up, it's working against gravity. You kind of stop, blood's going to come back down, but we want to prevent that backflow, so the valves only open in one direction and they close. It prevents that blood from going all the way back down to your feet. So they help to ensure one-way direction or one-way flow of blood. But even more important is we have a skeletal muscle pump as well as we call a respiratory pump. So I would put big stars by these. These are the two most important means by which we're going to try to make sure we can get blood back to the heart despite having relatively lower pressures in there. So movement, contraction of skeletal muscles around those blood vessels enhances that return of blood. They refer to that term milking action. So physical movement helps to push that blood back to the heart. You also have a respiratory pump. So when you inhale, there's actually a drop in pressure that occurs in your thorax. So you have actually a decreased interthoracic pressure. Now, what happens though, that helps to get air into our lungs, but at the same time, that causes the large veins near your heart to expand and to fill. So it's going to allow us to be able to get more blood back into that heart. Now, when you exhale, when you breathe out, the thoracic cavity decreases in size, which increases that pressure, the internal pressure that forces air out of your lungs, but it also pushes the venous blood into your right atrium. So the physical act of actually breathing helps to make sure we get blood going back to the heart. So I want you to just think about what can happen. So some of you have seen this or have experienced it. If you ever watched people that's like, especially if they're outside, it's warm out, and they stay perfectly still, you see some of them start passing out. Well, what can happen is because of that lack of movement, blood is going to start pulling at your feet. And if you have less blood going back to your heart, that's less venous return, that leads to less cardiac output. Less cardiac output, that's decreased blood pressure. It can lead to decreased blood pressure. You're not going to get perfusion of blood to your brain, and you're going to pass out. And so they always say, people who've been in the military, you don't stay perfectly at attention. You're at attention, but they're asking to like pull up your kneecaps. They're doing stuff with their legs, but you can't really notice it because they've got the pants on, that it's allowing blood to kind of keep going back to the heart. So movement helps. I personally suffer from an issue where when I'm standing up, I do have a problem getting blood back to my heart because I have defective valves in my veins, in my legs. I've got varicose veins. I also have other issues that we'll talk about a little later, not necessarily my issues, but there are certain reflexes that help to make sure when you change body position that allows blood to go back up to the heart. Well, I have issues with that. So I have to make sure I do keep moving. I don't want to stay perfectly still. And anytime I start feeling a little lightheaded, I make sure I really concentrate on my breathing. So I try to make sure I breathe real well to try to keep that blood going back to my heart. So one other thing I want to mention is distribution of blood. So you see a pie chart here. It's one of the few instances you'll ever see me show you a pie chart. Is the total blood volume in your body, average, it's about 5 liters. And I'm just averaging males and females. Males, it's a little bit more. But you have 5 liters of blood in your body. The distribution is not even. You'll notice a large amount of it, 64%, is in we call our systemic venous system. That's at rest. So here you're seeing it at rest. You'll notice that in your pulmonary circulation, you have only 9%. It's a relatively small circulation. Your systemic arterial system is 13%. Now, if we look here at the heart, I do want to bring your attention to this. Heart is about 7%. Notice it's the same as your systemic capillaries. That's always going to be the same, always, no matter what. So what's in your heart percentage will always be what's in the capillaries, because that's what's eventually going to get to those capillaries, is the blood that's in your heart. Now, this is showing you the distribution at rest. What happens when, say, we exercise? But before I do that, you just want to think about it, is I'm going to use that term again. This pie chart shows you, because of the distribution of blood, with most of that blood is in your systemic venous system, 64%. The veins are high capacitance vessels. Now, they have kind of literally means high capacity. Now, but what's even more important is these vessels can expand relatively easily with very little pressure. So you can have a lot of volume in there without affecting pressure that much. Now, the veins will redistribute the blood volume if necessary. So if you exercise, show here, notice when this person's exercising, the amount of your total blood flow is changing. You notice the skeletal muscle, it got a lot higher. You notice you got more to the skin. You're seeing less in some areas because you're not all of a sudden going to have more blood. You still have, say, 5 liters of blood, but the amount of blood going to certain places in your body will be greater than others. I need to, when I exercise, is to increase your cardiac output. I need to get a certain volume to certain tissues at a greater rate, because cardiac output is a rate. And so what can happen is I'm going to redistribute the blood. And so what's going to happen is, if we look at this chart, this is going to get smaller. Veins have smooth muscle. If you contract that smooth muscle, blood, or I should say contract, the blood vessels are going to get smaller. The lumen size gets smaller. Blood is going to go to other places. And what happens is it's going to go over in here. So you're going to end up getting more blood to other areas in your body. Now, just think about when you exercise. You're going to have more blood in your heart. Heart's working more. It has to pump that blood to those tissues. The systemic capillaries will increase. More blood in the systemic arterial system. So all we're doing is redistribute the blood from the veins more into your arterial system. And obviously we're going to have more blood going up into the pulmonary circulation because you need to exchange those gases. Now the same thing with the redistribution of blood can happen also, let's see if I have a picture for it, is if you're hemorrhaging. So that redistribution of blood will be important. There are certain larger veins in your body that we refer to as specific venous blood reservoirs. Is what will happen if you're hemorrhaging. Systemic veins, these certain systemic veins will constrict, which allow more volume to go to your arterial system and your capillaries. So we have veins in your liver, your skin, your certain areas will redistribute the blood to the general circulation. So the spleen has a certain volume of blood. If I remember correctly, don't write this down. I think it's got like at 150 mils of blood that it can give up. Liver has some large abdominal veins in your abdomen region. Venous plexuses, that means networks of the skin. Just think about it. When someone's hemorrhaging, they're losing blood. Because of what's going to be going on, we're going to redistribute the blood to the arterial system and the capillaries. We're going to reduce blood flow to your skin, and does the person look different? They start, because of the lack of blood flow to the skin, they're going to get bluish and get pale, get white, because of that redistribution of blood. So I just wanted to just put that out there for you. Now another thing I do want to mention, since I mentioned it earlier, is that when I had mentioned about that high capacitance, or in talking about that blood reservoir system, is think of it practically. Is I had mentioned that you can the veins can get a certain volume of blood without pressure changing that much because they have a high capacitance. And another term is they're very compliant. It's another term we can use for the veins. Is I want you to think about if you donate blood or you lose a certain volume of blood for any reason. Most of the lost blood comes from your veins, because when you donate blood, they take it from the veins. Now, as the volume of blood in the veins decreases, the accompanying drop in venous pressure, which is important in getting that blood back to the heart, is actually relatively small, because the veins have very high compliance. They're very compliant. Because, venous return is the difference between venous pressure and that pressure up in where right before you hit the heart. Therefore, the veins can actually lose a relatively large volume of blood before a drop in venous pressure becomes big enough to cause a significant decrease in venous return and therefore cardiac output. So it's important that those veins are the way they are. And so you just think about when you donate blood, it comes from the veins. When you're given blood, it goes into the venous system. So the pressures don't change as much when you either lose a little bit of blood or they give you some blood, because those vessels are very compliant. And so I'm just going to, compliance has to do with how much, I'm just giving an equation. Given change in volume for a given change in pressure. So if something is fairly compliant, very small pressure change, you can get a large volume of blood in there. So that's one of the ways to think about it. Or if I put, another way to look at it is I can put a certain volume of blood in a vessel and the pressure doesn't change that much, and that would mean a vessel is fairly compliant. Okay, so we're going to leave it there. Next recording, we're going to be looking at some other concepts associated with the circulation, looking at hemodynamics.